Teeth Neurology video series, let's discuss about giant cell arteritis. Giant cell arteritis is a cause of headache which occurs in people about the age of 60, usually 65, can happen below 60, very rare, mostly always about 65. Giant cell arteritis primarily affects the temporal artery, but can also affect other arteries like the internal maxillary branch of the external carotid artery. The symptoms are constant headache, mostly in the temporal area, which is right here, with temporal tenderness, meaning pain on palpation. You can have jaw claudication, pain on eating or chewing because the jaw muscles can be affected. You can have what we call as polymyalgia, which is generalized pain throughout the body, but the primary symptom is a constant headache, usually a new onset headache in an older person, which mostly is over the temporal area, but can also be diffuse headache. The danger of temporal arteritis, not so much the headache, is that you can go blind in an eye because the ischemic optic neuropathy, because the temporal artery also supplies the eye. And if you do not treat the giant cell arteritis, then you can get blind in that eye on one side, but you can also get blind on the other side, which is where you don't even have the headache. So that is the risk of temporal arteritis. That's why when you suspect it, you should start treatment right away. And how do you suspect it? From clinical symptoms, of course, older person with headache. The blood work we check is ESR, which is erythrocyte sedimentation rate, and C-reactive protein. If those are elevated, and if the person is an older person with headache, you have to strongly suspect giant cell arteritis. Some of the most specialized tests include a biopsy. Temporal artery biopsy is done by a surgeon where they take a piece of the temporal artery and study it to see if there are any pathology suggesting giant cell arteritis. However, the biopsy might be negative because there are skip lesions, meaning the part of the artery which is biopsied might not even show the pathology. So a negative temporal artery biopsy does not necessarily rule out the diagnosis of giant cell arteritis, but that's the most specialized test we do to confirm the diagnosis. Sometimes temporal artery ultrasound might be useful, not that highly specific, but sometimes it could be useful. It's a non-invasive way of checking. So the treatment is long-term steroids. We usually start at about 60 milligrams a day, and then we keep decreasing the dosage and we keep the person the lowest possible dose, basically so that the headache is relieved, but also we see if the ESR and C-reactive protein are decreasing. The diagnosis, again, carries a weight of blindness if not diagnosed properly. And I emphasize that if suspected, the person should be treated with giant cell arteritis even before the diagnosis is confirmed.